Hello everyone, I am Ten Xiaoping, the Infection Control Nurse from Bali Psychiatric Center, Ministry of Health and Welfare. In today's class, we will discuss the training for donning and doffing personal protective equipment in response to COVID-19 coronavirus disease. The course outline is divided into two parts. The first one is about the Precussion, and the other one is about personal protective equipment. First, we will talk about the Precussion. The staff of medical institutions are advised to follow the standard precaution while taking care of the residents. They must also take concurrent transmission-based precautions. Transmission-based precaution include contact precautions, droplet precautions, and airborne precautions. The standard precaution are referred to the basic precaution, which everyone should abide by. The standard precaution not only apply to the medical institutions, but also apply to the residents at long-term care facilities. All residents, regardless of suspected or with confirmed cases, their blood, body fluid, secretion, excrement excluding sweat, and incomplete skin or mucosal tissue may carry all possible sources of infections. Hence, standard precaution will be required. These standard precautions include hand hygiene, respiratory hygiene, cough etiquette, use of personal protective equipment, environment and objects cleaning and disinfection, blood and body fluid. Blood, body fluid including vomits, urine and excrement treatment, clothing and bed sheets treatment and cleaning, and waste disposal, all fall in the scope of standard precaution. Transmission-based precautions. All personnel should follow the aforementioned standard precaution in work. The purpose is to protect and prevent personnel from the mutual spread of pathogens with the residents when providing services. When taking care of residents with infectious symptoms. Apart from taking standard precaution, the transmission-based precautions should also be taken. Transmission-based precautions include contact precautions, droplet precautions, and airborne precautions. The objects of standard precaution not only apply to the hospitals we've just mentioned, but also apply to residents at the long-term care facilities, no matter those residents are suspected or confirmed of the infection. What is the required equipment for standard precaution? You may be in contact or having blood, body fluid, secretion, and excrement splattered on you in the interaction with the residents. You may also be in contact with damaged skin or mucosal tissue, etc. Check the possible body paths of exposure and operations for execution, and choose gloves, gown, and protection for the eyes, mouth, and nose, including face shield or goggles. For residents suspected and requiring protection of the respiratory tract, when you need to execute some measures that could cause droplet particles such as bronchoscopy, respiratory tract suction, sputum suction, and intubation, you will need to put on the medical mask, wear gloves and gowns, face shield or goggles. Transmission-based precautions. The main purpose of contact precautions is to prevent the pathogens spread from the direct or indirect contact with residents or the environment where residents stay. When you re-contact the resident or other environment, you should put on the gloves and gown. In case of possible blood or fluid splatter from infected residents, put on medical mask and other personal protective equipment. Remember to remove and dispose contaminated protective equipment before leaving the care environment and wash hands correctly later. The droplet precautions mainly aim to reduce risks of droplet infection through coughing, sneezing, and conversation. It is required to put on medical mask when taking care of the residents within 1 meter. Depending on the risk assessment, the use of eye protection may be required. You can choose goggles and face shields for eye protection. The main purpose of protection for airborne infection is to prevent pathogens floating through the air. We will need to upgrade the medical mask equipment in the care process. We must wear masks that are N95 Respirator grade or higher. Then we need to talk about the suggestions for personal protective equipment when taking care of those in risks of COVID-19. What are the suggestions for the personal protective equipment used in long-term care facilities, social welfare organizations, child and youth placement agencies, and correctional organizations? It depends on the types of service objects. For assessment services, the service personnel in contact with the objects when entering their houses must put on the medical mask and gloves. For home, community, and dormitory services, including the food service, transport, or rehabilitation bus services, as well as child and youth placement agencies and correctional organizations. The personnel must put on medical masks in work during the pandemic period. When entering the houses or rooms of servicing, the personnel providing the services must put on medical masks and gloves during contact. For services that might trigger droplets, such as sputum suction or risks of blood and body fluid splatter, we will need to put on the gown or use apron with goggles and face shield. We suggest 2 personal protective equipment for dormitory-type institutions. One is when we enter homes or rooms with risks of infection, and the other one is the work projects and protective equipment without entering the room. First, let's talk about when we enter the home and the rooms with risk of infection. If you have to assist with meal preparation, intake, feeding, turning the body over, putting on the clothes, and those involving physical and care in life, when you help with house chore services and accompany services, and measuring body temperature, health evaluation, rehabilitation care, and nutrition care, you will need to put on the medical mask and gloves when performing these services. If you need to assist with showering, changing diapers, and cleaning the environment, other than using medical mask or gloves, you will also need to put on the gown or apron. For contact and care of persons suspected of COVID-19, you need to clean and disinfect the region of COVID-19 case. If it's possible to be splattered by blood, body fluid, and droplet, you must upgrade the level of medical mask to N95 Respirator. You also need to put on the gloves, gown, and goggles. If you don't need to enter the homes and rooms with risk of infection, or if you do not need to engage in close contact, including delivering meals to the door of the case's house, you can choose to wear the medical mask depending on the situation. Close contact, including transport, measuring body temperature, and health evaluation, will require putting on the medical mask. This also depends on the situation to determine if gloves are required. Additionally, in times of group activities, it will depend on the actual care to see if medical mask and gloves are needed. When you expect large amount of body fluid splatter, It is suggested to use regular gown plus waterproof apron, or you can wear water-resistant gown directly. Gloves and gown for personal protective equipment are used in case of potential risks with the blood and body fluid. If you need to touch blood, body fluid, secretion, excrement, splatter, or droplet, use personal protective equipment including medical mask, gloves, gown, apron, and goggles. If you need to touch blood or infectious substance, mucosal tissue, damaged skin, and contaminated undamaged skin, including the incontinence or stool and urine by residents, you will need to put on the gloves. However, note that you should not wear the same gloves repeatedly. You need to change the glove if you need to take care of one or more residents in gown. Wear the one set for the same resident. Do not reuse or clean the gloves. The order of care work should start from the clean part to the contaminated parts for the one resident. Do not handle work such as picking up the phone with gloves. For protective equipment of eyes, mouth, and nose, we need to assess the risks of work nature. We need to protect the face, mouth, nose, and eyes to avoid contamination by droplet and droplet particles used by the combination needed. There are medical masks, N95 Respirator, goggles, and face shield for protecting eyes, mouth, and nose. How do we distinguish a medical mask? There are two sides of a medical mask. First, check the colors. The side with color or darker color should face outward. Check the nose wire. The exposed nose wire should face outward. Check the ear loops. The sewing part of ear loop should face outward. Fourth, you can touch and feel. The rough side is waterproof and water repellent. It should face outside. The softer side faces the mouth. The side with stronger water absorption should face inward. When you purchase medical masks made in Taiwan, make sure they come with description and name of manufacturers, as well as the address and number of medical device license. What is the number of medical device license? It will be printed with the MOHW Medical Device Manufacturing or 字一制 number. Starting from September 17, 2020, all medical masks made in Taiwan will come with dual-pressed prints. Each mask will be pressed with MD and made in Taiwan. These are the medical masks made in Taiwan. How do we put on and take off medical mask correctly? First, your medical mask must fit your face. Sizes too big or small not fitting your face will allow hazardous substances in the air to go into our medical mask and cause infection. Wash your hands correctly before putting on the medical mask. The 4 steps to wear medical mask correctly are open, put on, press, and tighten. First, open the medical mask and check if it's damaged or the ear loops are broken. Then put the masks on. Hang the loops on the ears. Fix the nose strip on the bridge of nose by pressing it onto the nose. The medical mask must adhere to the nose. Pull the medical mask and cover the nose and mouth. Pressing the nose wire is to fix the wire on the bridge of the nose. The medical mask must adhere to the bridge of nose. Check if it fits tightly. The medical mask must be fit to the face tightly. Then you are wearing the medical mask correctly. To take off the medical mask, grab the ear loops of the medical mask. Do not touch the outside of medical mask, because the outside is the contaminated side. When you take the medical mask off, throw it into the infection waste bins for medical wastes. We need to throw them into the waste bin for medical wastes when performing medical work. Finally, wash your hands correctly. We did mention that if there is blood and body fluid splatter, we need to upgrade to N95 Respirator. You must conduct a fit check when wearing N95 Respirator. Wash hands correctly before wearing N95 Respirator each time. Check the tightness for the mask. What do you do when executing tightness check? Inhale when you first put it on. Like this, press the side of N95 Respirator with two hands. You'll feel the N95 Respirator clap slightly when you inhale. It means you are inhaling correctly. Watch for any air leak on the edge of the N95 Respirator when you exhale. Check if there is air leaking on either sides. If there is air leaking, the size might not fit well or you do not wear it tightly. You need to readjust. We need to remove the bottom of the fastening strap when removing the N95 Respirator. Put this one up. Grab the strap and pull the side up. The outside of the N95 Respirator is contaminated and do not touch. Throw the N95 Respirator into the infection waste bin after taking off. Wash your hands correctly afterwards. As for the eye protection, it includes the goggles and face shield. When you wear the goggles and all equipment, you must wash hands correctly. You must fasten the adjustable ear hanger or the elastic band of the goggles on the head. Fasten the headband on the forehead when wearing the face shield. The goggle must stay tight with the face. Make sure it's not too tight or too loose. You will feel uncomfortable when it's too tight. But if it's too loose, infectious substance will go into your eyes and cause infection. Note that even if you wear glasses, glasses cannot replace goggles and face shield. You will still need to use standard goggles and face shield. To take off face shield and goggles, use the hand without the gloves to grab the adjustable ear hanger and headband to pull it down. After removal, if the goggles or face shield are not disposable, and if they must be recycled, store them in the container prepared for subsequent disinfection and treatment. If they are for single use and disposable, throw the face shields in the infectious waste bins and then wash hands correctly. Gloves are very important. Gloves are the last equipment for personal protective equipment to put on. We must choose proper size and material. For example, choose sizes S, M, L, or a bigger size according to the size of your hands. The gloves must be tight and cover your hands completely. Wash your hands before putting them on. You can put on the gloves after washing your hands. If you also need to wear a gun with the gloves, you must pull up the sleeve of the gloves to cover the sleeves of gun. Then you will wear a complete equipment. When taking off the gloves, touch the clean area with clean hands and stains with contaminated areas. For example, when you take off the gloves, the left-hand glove is contaminated. To take off the right-hand glove, use the contaminated side to pull it up. You will have one hand with glove and pulling off the contaminated glove. You're holding it in hands. Your right hand without glove is clean. Pinch the inside of the glove, which is the clean side. Pull it down and remove completely. You will cover the first glove with this glove, like wearing one set of gloves. And then you throw it in the infection waste bin. Of course, you have to wash your hands at the end. You will need to wear the gown in case of contacting infection in the institution. The gown or apron aims to protect the skin and work clothes of the personnel. so they will avoid the splatter and contamination by blood, body fluid, and infectious substance. We should also avoid infectious substance in the environment. We will now talk about the gown. Wash your hands before wearing it. Choose proper size of gown. Choose smaller size if your size is smaller. Choose the size that fits you well. Use water-resistant gown in isolation room. The length should cover up your calves. The opening of gown is the back and not the front. Like this, it should be in the front. Tighten the position of the neck and wrist. Other than tightening the neck, crimple the wrist and tighten the waist. When taking off the gown, do not shake violently when taking off the equipment. Move gently. Gently remove the neck of the gown and the strap on the waist. Take off slowly from the inside. The inside is the clean side and face it outward. Roll up the gun with the inside facing out. This will roll up the contaminated side. The gun will become smaller and can be thrown into the infection waste bin. Finally, you will need to wash hands correctly. Then we will talk about the precautions for donning and doffing personal protective equipment when engaged in the care of COVID-19 objects. Precautions for donning and doffing personal protective equipment. The institution, nursing station, or workstations are clean areas where we can wear the personal protective equipment. We can wear the personal protective equipment in clean treatment rooms. We will need an observer or mirror to observe if our personal protection equipment are up to standards when we wear them. Washing hands is required before wearing personal protective equipment. You must wear the personal protective equipment before entering the isolation room or isolation area. Do not wear the equipment inside. We must wear the equipment at the clean areas of nursing station or workstation before entering the isolation room. This is the standard process. Personnel without taking off gloves, washing hands, taking off gown, cannot enter the nursing station or workstation. This will avoid the contamination of all environments of infection with others. Remove all equipment after leaving the isolation room. We are not equipped when entering the nursing station. Process of wearing personal protective equipment. In the case of wearing N95 respirator, prepare the N95 respirator. If such upgrade is necessary in the wearing process, we will need to prepare N95 respirator, gown, and eye protection, including the protective face shield or goggles. We also need gloves. To prepare these items, we must perform hand hygiene when wearing them. That means to wash your hands. After washing your hands correctly, we will put on the N95 respirator. We must complete the tightness check for N95 respirator as mentioned earlier. We check for tightness in inhaling and exhaling. After verifying the tightness, we will put on the gown. Remember, the opening of the gown faces to the back. And you must fasten the strap. Fourth, we need to put on the eye protection. You may choose face shield or goggles. Check for tightness and comfort. Fifth, we need to put on the gloves. As we reminded everyone, if you need to put on gloves with gum, you need to cover the sleeves. They need to be tightened so you will not touch any infectious substance. What are the precautions when you reach the contaminated area? Do not wear the equipment and put on or take off the protective equipment in the same place. Like what I said earlier, wear the equipment in the cooling areas of nursing station or workstation. Take off the equipment near the isolated area. We will introduce you later. The clean area and contaminated area must not be crossed or overlapped. Do not touch your face or adjust or touch other protective equipment already put on your body with the gloves after entering the contaminated area. Take off the gloves immediately if there is any damage. Replace with new and clean gloves. Wash your hands before replacing new gloves. You must wash hands in between in addition to avoiding any unnecessary contact with objects and the environment. Reduce unnecessary contact. You will avoid infection by reducing the contact. We talked about the outfit. And now we talk about the process of precaution when you take the equipment off. If we need to take off the outfit mentioned earlier, we need to first take off the gloves. We reminded everyone that touch the clean part with clean glove and stain with contaminated glove. We can remove it completely. Then we take off the gown. The outside of gown is contaminated and the inside is clean. Avoid touching the contaminated side. After rolling it up and taking off the gloves and gown, wash hands correctly. Then we take off eye protection. Finally, we take off N95 Respirator. This high-efficiency filtering mask is N95 Respirator. Pull the strap under the N95 Respirator up. Pull the strap up, and then throw the mask to the infection waste bin. We will wash hands correctly one last time. What are the precautions for taking off the equipment? We wear N95 Respirator, and before we leave the isolation room, if there's an anteroom in front, before leaving the isolation room, we must take it off immediately after closing the door. That means we take off the N95 Respirator in the anteroom. We need to wash hands correctly. Make sure the environment and people outside the isolation room and region will not be contaminated when taking off the personal equipment. You have to make sure not to affect others. The place for you to take off personal protective equipment may vary slightly depending on the outfit specification or condition of patient's isolation. How's that? If you wear gloves only, before leaving the room of the resident, you can take off the gloves inside if you only wear gloves. But if you also wear the gown or the whole set of personal protective equipment, you must take the equipment off in the anteroom outside the resident room. However, not all institutions come with an anteroom. What can we do? If there's no anteroom, we can take off the equipment inside the resident room. That is the passage to the door of the room. Precaution for taking off personal protective equipment. In the example of gown, we must avoid contact with contaminated side in the process of taking off personal protective equipment. You are subject to infection once in contact. For the gown, the front of the outside of the gown is contaminated. The contaminated side is more likely to contact pathogen. It means it could infect us easily. Usually the front of the outside of protective equipment, also the front of the outside of gown, or like the front of outside of medical mask. What is the clean side? It is less likely to contact the pathogen. For example, the inside of medical mask, gown, the side and the back, the head and the back are the clean side. But do not neglect the clean sides, because the contaminated side is highly infectious. Precaution for taking off personal protective equipment, hand hygiene equipment. The hand washing equipment is necessary for the place for taking off the protective equipment. It can be dry or wet hand wash. You must also prepare the waste bins for infectious wastes. In case your hands are suspected or confirmed of contamination from the process of taking off equipment, you need to wash your hands. Wash your hands correctly after taking off personal protective equipment. For example, when you take this equipment off, you must throw infectious equipment into the infectious waste bin. If there's no anteroom and before leaving the resident room, we must take off the equipment in front of the door. We have been stressing the importance of wet or dry hand washing after taking off the equipment. Now we introduce you the keys for personnel in care of residents in risk of COVID-19. Taking care of residents in risks of COVID-19. If you need to assist with meal preparation, food intake, include feeding, turning over the body, clothing, and daily care, or accompanying and so on. We must wash hands correctly. Before performing these care services, how do you wash hands correctly? Correct hand washing includes wetting, scrubbing, rinsing, holding, and drying. For scrubbing, we need to scrub inside, outside, interlaced finger joints, backs of fingers, thumbs, fingernails, and wrist. We need to scrub for at least 15 to 20 seconds. You must wash your hands for 40 to 60 seconds. This will be a complete and effective hand washing. We must wash hands before taking care of anyone to assure the safety of our residents. We must put on medical masks when performing care work during the pandemic. We need to put on medical masks and gloves in contact or care of residents. Wash your hands correctly after taking off the equipment. We mentioned earlier that gloves are the last step on wearing the equipment. When we provide care services, we must put on the medical mask first. Remember to face the color side of the medical mask outward, and the light color side face the mouth. Press the nose wire on the nose. The mask must cover the mouth and nose. This will be completely tight. We put on the gloves after putting on the mask. Choose S, M, or L size of gloves according to your hands. Wash hands correctly after taking off the gloves. When providing services to residents in risk of COVID-19, if we are assisting them with showering, changing diaper, and environment cleaning, and other care measures, we need to wash hands before the services. We also need to put on the medical mask and gloves, as well as the regular gown and apron. Wash your hands after taking off the equipment. For the equipment you wear, you need to wash hands first. Then put on the medical mask. Cover the mouth and nose with medical mask under correct instruction. We then put on our gown. The opening of gown should be on the back. Keep the neck, waist, and sleeves tight and fastened. Finally, put on the gloves. Cover the cuffs of gown with gloves. It needs to stay tight so that contaminated substance will not penetrate and cause infection. If we expect splatter or blood or body fluid, or in case a large amount of splatter, we suggest you to wear water-resistant gown. Again, we remind you to cover the cuffs with the gown. Wash hands correctly after taking off the equipment. To take care of residents in risk of COVID-19, if our care services are likely to trigger blood or body fluid splatter, such as sputum suction or even endotracheal intubation, those things that could trigger splatter, we need to wash hands before the service. We must wear N95 respirator, gloves, gown, apron, and eye protection such as face shield and goggles. Wash hands after taking off equipment. For equipment preventing blood or body fluid splatter, we cannot wear medical mask because of the splatter, and we must upgrade to N95 respirator. We must first put on the N95 respirator and check the tightness for N95 respirator. Inhale to check for any slight collapse on the respirator. Exhale for any air leak outward. If you find either the tightness is not enough, it could be the size you choose does not fit your face. Choose S, M, L, or another size that fits your face. Check the tightness for completion. After putting on N95 respirator, we put on the face shield and gown. Finally, we put on the gloves. The gloves must cover the cuff of gown completely. When removing the equipment, remove the gloves first. Then the gun. Remove gently to avoid splatter. Wash hands after both times of removal. Take off the face shield after hand washing. Dispose the face shield to the infection waste bin if it is disposable. If it must be recycled, you should store it in a container for subsequent treatment. Disinfect the face shield before using it again. Finally, we remove our N95 respirator. Pull the strap off the N95 respirator and pull up the strap. Avoid contact with contaminated side, and then throw it into the infectious waste bin. After removing all equipment, wash hands one last time. We often see common infectious disease in long-term care facilities. The precautions become very important for us. We would like to remind everyone for one important rule. For droplet, airborne, and contact infectious disease, use droplet precautions for cold and influenza. For conducting droplet precautions, please put on the medical mask. And keep the distance 1 meter away. Try to keep 1 case per room. If the resident is infected, we try to keep the resident alone in 1 room to keep close observation so we can avoid cross-infection. For airborne disease, infectious disease including measles, TB, chickenpox, and disseminated herpes zoster are occasionally seen in long-term care facilities. In case of such suspected or confirmed case, we must upgrade the medical mask to N95 respirator. In general, such case must stay in negative pressure isolation room, but long-term care facilities usually do not have such facilities. We have isolation room for single person only. We will move such suspected case to isolation room for single patient. We will move the patient to the hospital for diagnosis as soon as possible. If the resident needs negative pressure, the hospital will determine if negative pressure room is needed. If the resident needs to return to our facilities, we will let the resident stay in single patient room for isolation. We will need to wear N95 respirator for care service. If it's a contagious disease, like we could see cases with scabies or viral gastroenteritis-induced diarrhea or vomiting in the institution, we will activate the contact precaution. We will also use medical mask for cases with viral gastroenteritis. We must wear gloves, gown, and try to keep patient per room for contact precaution. Such contact precaution does not require medical mask. Keep the cuffs of gown with gloves when gloves and gown are required. And take care with contact precaution. The standard precautions are care for all residents. We must implement the standard protection. What are the measures of standard protection? Wash hands correctly. Put on the medical mask. Wear gloves and gown. This is a standard protection. Thank you very much.